My name is Nathan Hawkins, and this is my presentation on Down syndrome. Start out with a little bit of the history of Down syndrome. The earliest depiction of an individual with Down syndrome is a Flemish painting of an angel that's dated from 1550. It was first named and labeled as a genetic disorder instead of just a mental disability in 1866 by English physician John Langdon Down. The cause of Down syndrome, however, was not discovered until a little more recently in 1959 by Marthe Gautier. Historically, people with Down syndrome have been ostracized from society. In the 1920s, there was a movement called the eugenic movement that actually made it legally required for individuals with Down syndrome to be sterilized in 33 states. This was to prevent the continuation of the disorder and promote a clean and perfect genetic line. By the way, this was kind of the basis for Nazism. This movement was shut down by protests in the 40s and 50s, thankfully. The cause of Down syndrome is basically when an infant inherits 2 copies of chromosome 21 from their mother and 1 from their father, causing there to be 3 copies altogether of chromosome 21 instead of just 2. This phenomenon is called trisomy 21. In terms of symptoms, many of the symptoms of Down syndrome are seen in physical appearance, such as slanted eyes, small ears, protruding tongue, also flattened nose and small mouth. It also affects brain development and the size of different structures within the brain, although scientists are not entirely sure why. Down syndrome is the leading cause for impaired cognition. People with Down syndrome will be plagued with learning difficulties all their lives. They're often also more susceptible to heart defects and coexisting psychiatric and behavior disorders such as OCD, ADHD, or autism. Down syndrome is diagnosed easiest at birth based on the physical traits that I mentioned before, and then it can be confirmed through a test called chromosomal karyotype. There are 2 types of prenatal tests that can be performed to determine the likelihood of an infant having Down syndrome. These are called screening tests and diagnosis tests. These tests are not included in the newborn screening process in the state of Missouri, however. Screening tests are performed in the first trimester of pregnancy and can determine with relative accuracy the likelihood of a child being born with Down syndrome. However, this is the least accurate of the 2 tests. There's a blood test which measures for abnormal levels of pregnancy-associated plasma protein A, and then the pregnancy hormone known as human chorionic gonadotropin. Finally, the nuchal translucency test examines a specific area on the back of the baby's neck to see if there's an abnormal amount of fluid gathering there. Diagnosis tests are performed if the screening tests return a high likelihood of the infant having Down syndrome, and they can predict much more accurately whether an infant will be born with Down syndrome. They include the chorionic villus sampling, in which cells from the placenta are used to analyze fetal chromosomes, and then amniocentesis, which examines amniotic fluid to test the fetal chromosomes. In terms of treatment, there is no real treatment for Down syndrome at the moment. Scientists are researching different therapies that can help restore cognitive function. Early intervention programs such as physical therapy, occupational therapy, and speech therapy are very helpful. However, inclusion in family and community life is really the best thing for the well-being of a person with Down syndrome. Just some facts about Down syndrome. The chances of an infant being born with Down syndrome actually increase significantly with the age, alongside the age of the mother at the time of birth. The odds, if the mother is 25 years old, the odds are 1 in 1250 that the child will be born with Down syndrome. However, when the mother is 45, the odds are actually 1 in 30. There are no demographics that have a higher risk of being born with Down syndrome. The average lifespan of a person with Down syndrome is more than 55 years. The National Down Syndrome Society was formed in 1979 to provide support for individuals with Down syndrome and for their families. And then World Down Syndrome Day was actually not too long ago on March 21st, and it is meant as for community events that raise public awareness for people with Down syndrome. These are my sources. Thank you for watching my presentation.